What I like the most about occupational medicine is my patients. I've gotten to meet some really interesting people, really cool jobs, and I get to see them through a tough time. When there is an injury or illness at work, it affects not just them, but really their family too, and really their whole life, because you think about it, your workplace is where you have your friends, what your identity is, plus it's your income. So, it's very stressful for people when this happens and they can't work. So it's really an honor to be able to get them through that, to really keep them working if at all possible, even through the injury or illness, but ultimately to get them back to their job. So when a new patient comes into our office, the first thing we want to do is really get a good history from that person. Our philosophy in occupational medicine at UC San Diego Health is to really tailor our care to a specific person, a specific workplace. And that's so important in occupational medicine because when they come in, we really want to know, what is their job? How did the injury happen? How can we prevent it from happening again? And then the other thing they can expect is that we are going to communicate. Medicine is about communication and collaboration if you really want to deliver the best care. What I like most about working at UC San Diego Health in Rancho Bernardo is that there's a focus on really bringing that latest and greatest research and innovation that UC San Diego Health is known for to patients. Medicine is changing so rapidly right now, as you can see in the news every day, but sometimes it's hard to really translate that to patient care. But we're really focused on that where we are right now. It's collaborative care. We have urgent care, specialty care, primary care, occupational medicine. We really do want to treat that whole person, that whole situation, and make people healthy and functional.